Okay, let's dive into something that, well, it touches all our lives at some point. Navigating the healthcare system.
Mm-hmm.
It can feel really overwhelming, right? Maybe you're trying to understand a diagnosis or figure out a bill or just, make sure you're getting the best possible care.
Yeah, there's just so much information flying at you.
Exactly.
And when the stakes are that high, feeling confident and informed isn't just nice to have, it's really essential.
Totally.
Cutting through that noise and knowing what truly matters,
Yeah.
that's the challenge.
Absolutely. So our mission in this deep dive is to, well, try and equip you with some key knowledge, stuff to help you navigate healthcare more effectively.
Okay.
We're going to look at this from two vital perspectives, and we're drawing insights from various sources here. First, how healthcare institutions themselves, work behind the scenes.
Right.
How they ensure quality and patient safety through things like accreditation.
The system side of things.
Exactly. And second, and this is just as crucial, what concrete steps you can take, particularly around managing and documenting information.
The personal side, how you protect yourself and ensure clarity.
Yes.
We've gathered insights from sources looking at, global standards, national standards, like
Yes.
those set by these accreditation bodies.
Mm-hmm.
And we've sort of married that with really practical ground-level advice from healthcare experts and patient advocates, people focused on the actual patient experience.
The goal here is really to pull out the most actionable and important nuggets so you can feel more empowered, hopefully safer, when you're interacting with doctors, hospitals, insurance companies, the whole system.
And what's fascinating, I think, is understanding that quality in healthcare isn't just hoped for, it's actually built systematically.
Right.
Institutions use these frameworks to hold themselves accountable.
Okay, let's unpack that institutional side first then.
Yeah.
How do hospitals and clinics actually aim for those high standards?
Well, a major way they do it is through something called accreditation. Think of these as independent bodies that set pretty rigorous benchmarks for safety and quality, and then they evaluate institutions against them.
So they're grading them in a way.
Sort of, yeah. On a global scale, Joint Commission International, or JCI, is a real leader here.
JCI. Okay.
Their mission, simply put, is about enabling and confirming the highest standards of healthcare quality and patient safety for everyone, everywhere. They really believe safe, quality care should be a universal expectation.
And they work internationally, you said?
Yeah, loads of countries. The core idea is they provide these really detailed standards, like how patient identification should work, how medications should be managed safely, protocols for preventing infections.
The nuts and bolts of safe care.
Exactly. And they also have specific international patient safety goals. These zero in on common sort of problem areas in healthcare where errors are maybe more likely to occur.
Like what kind of area?
Oh, things like making sure they do surgery on the right person, the right site, improving communication between caregivers, medication safety again. These goals are quite impactful because they highlight specific risks and push institutions to implement clear protocols to prevent them.
So by seeking JCI accreditation, an organization is basically saying, hey, we're voluntarily letting this outside group check us out.
Pretty much. We're subjecting ourselves to this external review to show we meet these internationally recognized standards for keeping patients safe and providing quality care.
So it's a signal.
Yeah.
A commitment. Not just them saying we're good, but proving it against a benchmark.
Right. And the sources point out benefits for the institutions too, It can improve their internal processes, boost staff teamwork.
Makes sense.
And it builds trust within the community. It shows a visible commitment to excellence and, importantly, risk reduction.
Okay. Now, bringing this closer to home for some of our listeners, in India, there's a similar national body, right, called NABH.
Yes, NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers. NABH is part of the Quality Council of India, and its function really mirrors JCI's, but within the Indian context, developing standards, running accreditation programs specifically for healthcare providers across India, establishing those crucial benchmarks for quality and safety there.
So we've got these bodies, JCI globally, NABH in India, setting high standards, evaluating hospitals. But let's connect this back to the listener. What does it really mean for you when you see that a hospital is accredited?
Well, it signifies that the organization has, proactively taken steps. They've worked to meet defined standards that are specifically designed to improve the safety and the quality of the care they provide.
So it's an indicator.
It's an indicator, yeah.
Okay.
A signal of their dedication to having strong processes in place for things like infection control, medication safety, patient rights, all that core stuff. Now, it's not an absolute guarantee that nothing will ever go wrong, of
Yeah,
course,
not that sure.
but it suggests a foundational level of commitment, a
No.
commitment to building a reliable system for patient care.
It gives you maybe a level of assurance that they're working from a recognized playbook focused on keeping you safe.
Exactly. It's about trying to embed quality into the sort of operational DNA of the organization.
Okay, that gives us a good picture of the institutional effort, how they try to build reliability. But here's where our deep dive gets, I think, really practical and empowering for you personally.
Right.
While institutions are working on their systems, there's an absolutely critical step you can take in your own healthcare journey.
And that is?
Becoming a master of documenting discussions and agreements.
Yes. This is an area our sources are incredibly clear on. A major pitfall, a big don't, is relying only on verbal promises, just conversations, in healthcare settings.
And intuitively, that's what most of us do, isn't it? We talk to the doctor, the nurse, the billing office. Why isn't just talking enough? What's the problem there?
Well, there are several really compelling reasons. Think about promises related to cost, for instance. You might be told, oh yeah, your insurance will cover this procedure. But if that's only verbal, it holds very little weight if the insurance company later denies the claim. Verbal agreements generally aren't legally binding in these complex healthcare and financial situations.
That makes sense. And I suppose people just forget things too.
Precisely. Details get lost. You might forget exactly what was said, the provider or their staff might forget. Or the information could even get lost in the system between different departments or passed to the insurance company incorrectly.
Right.
So if a problem pops up later, say a billing dispute or a complication from treatment, or you need to file a formal complaint having no record of what was actually agreed upon leaves you with,
Yeah.
well, no proof.
You've got nothing to stand on.
Exactly. And think about staff turnover, too. It's common in healthcare. The person you spoke to might not even work there anymore. Their memory of your conversation, gone with them.
Yeah, okay. The sources give some pretty common and often painful examples of this happening, don't they?
They do, like the patient who was assured their surgery was fully covered, only to face this huge bill because they had no written verification. Nothing from the insurer or the provider about coverage.
Right.
Or people who signed vague consent forms because the full details of, like, financial responsibility weren't clarified in writing beforehand.
Yeah.
We hear about cost estimates given verbally that just skyrocket later, or promises of insurance coverage made over the phone that weren't confirmed in writing, leading to the patient having to foot the entire bill themselves.
And it's not just financial either, is it? What about care instructions?
Absolutely. That's a huge one. Verbal follow-up advice may be given quickly as you're leaving without a written summary that can easily lead to confusion or complications.
Right.
And if something does go wrong, there's no official record of the instructions you were actually given. This is why making documentation a real habit is just so vital.
Okay, so what specifically should you be focusing on? What needs to get written down or recorded somehow?
Our sources really emphasize anything significant. So this includes things like appointment details, sure, but also recommendations for tests and get the full official names of those tests.
Good point.
Treatment plans, definitely. Consent forms for procedures or surgery, and please read them carefully before you sign. Don't feel rushed.
And the money side. What about costs?
Crucially, cost estimates. Always ask for a written good faith estimate for planned services, especially here in the U.S.
Okay.
If you're discussing insurance coverage or getting pre-approval, you need to demand a written reference number or confirmation from the insurer. And ask the provider's office to note this approval in your chart, too. Get it documented on both ends.
What about after a visit or a hospital stay, like when you're going home?
Discharge and follow-up instructions are absolutely paramount. Always ask for a printed summary. Always.
Don't just rely on remembering.
No way. And if the doctor or nurse adds extra verbal instructions while handing you the paper, make sure you note those down yourself right then and there. Or, even better, ask them, could you please add that to the printed summary for me?
Be proactive.
Yes. Also, any specific agreements the provider makes, maybe they say they'll waive a certain fee or won't charge for a specific thing, get that noted down somewhere. In your chart, on the bill, an email follow-up. Somewhere in writing.
Okay, knowing what to document is one thing.
Yeah.
But how do you actually do this?
Yeah.
without feeling like, you're being difficult or distrustful.
Yeah, that's a common concern, but the sources offer really practical strategies, and often it can be surprisingly simple,
Like
like just asking politely, could I get that in writing, please? Or is it possible to email me the summary of our discussion? Most reputable places have procedures for providing written information. They expect it,
Oh, wow.
and technology is definitely your friend here. Don't hesitate to take photos with your phone. Snap a picture of a prescription, printed instructions, even notes a doctor writes on a whiteboard in the exam room if it's important.
Ah,
Request that test results and visit summaries be emailed to you or uploaded to your online patient portal if they have one.
use the portal.
Absolutely. You can even use email or secure messaging within that portal to confirm administrative details with the office staff, like appointment times or billing questions. Creates a nice record.
What about phone calls? Especially
Yeah.
with, insurers or billing departments. Those can be tricky.
Very. For those, get into the habit of taking notes during the call. Write down the date, the time, who you spoke to, get their name or an ID number if you can, and the key points of the conversation.
Okay.
And crucially, any reference numbers they give you. Then maybe follow up with a brief email. Just confirming my understanding of our call today and summarize the key points. Ask them to reply confirming it's accurate.
That's clever. It creates a written record of that verbal chat.
Exactly. A paper trail, even if it starts verbally.
What about during an actual in-person visit? When you're right there,
Always ask for copies of forms before you feel pressured to sign them.
take a moment to read.
Yes, read them carefully. And the sources suggest you even have the right to handwrite amendments onto forms before signing.
Really? You can change them.
Within reason, yes. For example, if a form says you agree to all potential charges, and that wasn't discussed, you might cross that out and write something like, agree only to confirmed in-network fees, or whatever reflects your understanding. Or specify exactly which procedure, and maybe even the agreed price if it's left vague. Then initial your come to your change.
Wow, that feels really empowering, actually taking control of the document itself.
It is, and always ask for written summaries of important discussions, explanations of procedures, follow-up plans. If you're discussing financial assistance or charity care, get the approval and the terms clearly in writing.
Right.
And one more thing, if you ever have to dispute a bill, send your dispute letter via certified mail.
Why certified?
So you have proof it was sent and, more importantly, received. And always include copies, never originals, of any documentation you have to support your case.
Good practical tips.
Yeah.
Are there any specific warning signs, like red flags, where you absolutely must insist on documentation?
Yeah, the sources highlight a few key ones to watch out for. If someone says, oh, we don't provide that in writing, or we can't put costs in writing because they might change, those are major red flags.
What should you do then?
Push back firmly but politely. Or, honestly, consider finding a different provider if that's an option. Also, never, ever sign a form that is incomplete. Or if someone tells you, just sign here, we'll fill in the details later.
No way.
Absolutely not. Insist everything is clear and filled out before your signature goes on that line.
And this isn't just for managing your own care, right?
Sure.
What if you're a caregiver?
Oh, absolutely critical then. If you're helping a parent or another family member, especially someone elderly who might have trouble understanding or remembering, documenting discussions and instructions is vital.
It becomes their safety net.
It really does. It ensures continuity, accuracy, especially if multiple family members are involved in care. And once you start collecting all this documentation, keep it organized.
How do you suggest doing
It
that?
doesn't have to be fancy. Digital folders, physical folders, whatever works for you. But label everything clearly by date, by provider, by issue.
Right.
And keep digital copies backed up somewhere safe, like the cloud. Maybe make sure a trusted family member knows where to access everything in an emergency.
So beyond just protecting yourself in disputes, what are the other upsides? The benefits of having all this documented info easily available?
Oh, it's invaluable. If you need to seek a second opinion, you have a clear, organized record of diagnoses, tests already done, treatments tried.
Saves repeating things.
Exactly. It helps you track your own health history over time, avoids unnecessary or duplicate tests, which saves money and hassle, and it significantly simplifies filing insurance claims or appealing denials.
Because you have the proof.
You have the proof. Written records just provide clarity in a way that, verbal conversations simply can't match. It's about creating your own reliable record within a system that, while it strives for quality, can still have points of failure in communication and documentation.
Okay, so let's try and wrap this up. What does this all mean for you, the listener? We've taken this deep dive into how healthcare organizations work towards quality and safety things like accreditation, which signals a commitment to external standards.
The institutional side.
Right. And we've explored in pretty practical detail how you can actively participate, how you can ensure clarity, accuracy, and protection in your own healthcare journey by making meticulous documentation a real habit.
Yeah, and the core takeaway from our sources on that front is really powerful and clear. Never, ever rely only on verbal agreements in healthcare.
Just don't do it.
Don't do it. Insist on clear written communication for anything important. Treatment plans, costs, instructions, agreements, anything that matters.
It really seems like one of the most effective ways you can advocate for yourself, for your health, your finances, and frankly, your peace of mind in what can be a really complex system.
Absolutely. And maybe here's a final thought to consider as you go forward.
Okay.
If these accredited institutions are genuinely aiming to build reliability into their processes, right? How does your personal practice, your habit of careful documentation, not only protect you, but how might it also contribute to a more reliable overall healthcare experience?
Interesting.
By consistently asking for things in writing, by showing you expect clear documentation, maybe you subtly encourage better practices across the system itself. Think about how your individual action, your documentation habit, and the institution's quality efforts, how they can potentially work together. Synergize, maybe, to create a safer, more transparent system for everyone involved.